Call upon the Honourable Mr Sims.
Thank you, Mr President. I move the motion standing in my name.
It is seconded.
Thank you. Mr President, I move that this Council notes the South Australian Government commissioned the Unmet Mental Health Service Need in South Australia report to determine the level of shortfall and future investment required to deliver mental health services in South Australia. The State Budget 2026 and 2027 prioritised mental health funding for crisis and hospital services with no new funding allocated to deliver specialised mental health community support programs. South Australia requires an investment of $125 million per annum to meet community-based mental health needs for South Australians who don't have access to supports. And for every dollar invested by the state government in community-based mental health services, there is an economic return of investment of $2.41. There are, according to the report, 19,000 South Australians currently living with severe mental health issues who are not receiving any form of service or support to address their complex mental health needs. And so this motion calls on the Minister for Health and Wellbeing to request an agreement at the upcoming Joint Health and Mental Health Ministers meeting for a timeline to address the shortfall in services. Now, it's pretty disappointing, Mr President, that the Labor government commissioned this report back in 2023, the unmet mental health service need in South Australia that could be met by the NGO sector report. And as often tends to be the case with this Labor government when it comes to reports or committee inquiries, it's sitting in a drawer somewhere gathering dust rather than being implemented. Now, I welcome the fact, of course, that the government is putting an increased focus on our hospital system after failing to get ramping under control in the previous Parliament and having made an election commitment, of course, in 2022 that they would get ramping under control. They've failed to do that, but I do welcome the fact that they're putting more of an emphasis on our hospital system. But preventative health is also vitally important, and we know that often when you turn up at an ambulance, you're at the more serious end, and being able to provide mental health support to people that are struggling early on in the piece is really worthwhile. And as this motion notes, it does come with a significant economic return as well. That is $2.41 for every dollar that is invested in community-based mental health services. And so I think it's time for the government to really start to put an emphasis on that and to recognise the value of this. And if this motion passes, I hope that the Minister for Health and Wellbeing will raise this at a national level to see what can be done in terms of collaboration across states and at a national level to make sure that this unmet need is finally met, because it's now the third budget in a row where we are not seeing the commitment that is needed to really get this under control and make significant headway. And this is a matter, of course, that the Greens will continue to raise in this place. I flag, as I did with the previous motion, that I intend to bring this to a vote after the parliamentary break.